Welcome to the Windsor-Essex County Health Unit's media briefing for Thursday, April the 14th. We are joined today by our acting MOH, Dr. Shankar Nesathuri, our CEO, Nicole Dupuis, and our manager of epidemiology, Ramsey D'Souza. We will start our session today with our epidemiology summary. So Ramsey, you can go ahead.
Thank you, Ashley. Good morning, everyone. Thank you for joining us for this week's media briefing. I will provide an overview of what we're seeing in this week's epi summary. So let's begin. So for this week, when we look at our case rates has once again continued to increase from where we were since the beginning of March. It's currently at about 188 cases per 100,000. This equates to about a 23% increase from where we were last week. When we look at how we fare with other health units across the board for all but a couple of health units, we have seen an increase in their case rates for the most completed week. Most of the increases are seen in some of the northern regions in terms of the magnitude of the increase, but across all PHUs, we have seen an increase there. Windsor-Essex currently ranks 10th overall in the province for the week's case rates. But as mentioned, we are continuing to see an increase across the province. Just like the previous slide, figure, we continue to also see an increase in our percent positivity. It's hovering at about just under 21%. When we look at the previous weeks and overall the past month, we've seen a gradual, week over week increase in that indicator. When we look at our hospitalizations in Windsor-Essex and in Ontario for our inpatient hospitalizations, we are seeing an increase there as well. It's increased to, and we're currently seeing that current levels are at the end of what we're seeing at the end of January, beginning of February, and it's at the moment continuing to head up. With regards to our ICU, the ICU admissions for COVID-19 in Ontario has been slightly increasing day over day, give or take. Whereas for us in Windsor-Essex, we have seen an increase in DKs over the past few weeks, so it remains relatively unchanged from where we were this time last week. When we look at our wastewater surveillance data, here is where we start to notice the magnitude a little bit in terms of what we're seeing with COVID-19. Our current levels, the viral intensity is almost at the peak of what we're seeing during the initial Omicron wave towards the end of December and early January. For this specific week, we looked at our case data for the past month, our high-risk case data, and wanted to give a sense of what symptoms people were experiencing. Please note that individuals can report more than one symptom, so the percentages will not add up to 100%. About 11% of our cases were asymptomatic, and just over 50% of cases had a cough and a sore throat, followed by nasal congestion and headache. When we look at our deaths, we continue to see 2 to 4 deaths in a given week. For this specific week, we saw an increase of 1 death from where we were last week, so for a total of 3 deaths for our most recent completed week. With regards to outbreaks, we continue to also experience a number of outbreaks in the region that we're newly declaring week over week. For our most recent completed week, we had declared 10 outbreaks, whereas in the previous week there were only 7. Just to keep just to add a note too, these are outbreaks in very specific settings, so such as in long-term care retirement homes, hospital settings, and in other congregate living settings. Moving on to our vaccination status in the community, with regards to second doses, we continue to see very minor changes week over week. Overall, it currently sits at 83.5% for those 5 years and older, and currently the lowest uptake is among those that are 5 to 11 years old, just over 30%. Vaccination coverage rate. When we look at our third doses, It follows a similar trend, though it's more skewed in terms of coverage rate for those that are 60 years and older. The coverage rate in that age bracket is on average about 77% overall. But amongst those that are eligible, 12 plus, the current vaccination coverage rate is 51.1%, with more work to be done in some of the younger age groups, especially those 12 to 17 and older. Just as in previous weeks, we continue to experience differences by geography. There are certain areas in our community, especially those in our hotspots, that have a lower coverage rate, whereas overall coverage rate for those that even are who are not eligible and ineligible is at 79.8%, just under 80%. One of the things I also forgot to mention too was when we were looking at our hospitalization for COVID-19, we also looked at our data as it relates to those who present to the ED for any type of symptoms as it relates to fever, influenza-like illness, or any type of respiratory symptoms. And in the past 2 weeks, we have seen an increase there as well. 3 weeks ago, we were at 4.4% of all ED visits were related to respiratory type symptoms, whereas in the most recent completed week of last week, that almost doubled. That almost doubled to 8.8%, just under 9%. Thank you.
Thank you, Ramsey. We will now turn it over to some opening remarks from Dr. Shankar-Nesathury.
So thank you so much, colleagues, for allowing the Public Health Service to speak today. I think just a couple of things to think of. One is, one key point is that the burden of disease in the Windsor-Essex Health District continues to increase. And that's manifest by the increasing number of people who are testing positive, number of people who have been identified as cases, the number of people who are currently hospitalized. I think the number is approximately 60 today, which is about 10% of hospital capacity. Additionally, the hospital system set out a press release yesterday indicating that they're feeling the pressures of increasing burden of COVID-like presentation and other respiratory illnesses. To place this in context of is that death is one of the things we're trying to prevent. On average, we're having 2 to 4 deaths, and Ramsey can correct me, but on average, these last few weeks, we've had 2 to 4 deaths a week. We've had 600 people die of COVID. Province-wide in 2020 and 2021, there were about 9,000 people who died of COVID. In that same period of time, there were about 900 people who died in car crashes. So COVID killed 10 times as many people than who died in car crashes. We're not out of the pandemic, but we do have to learn to live with COVID. So, what are the goals of the Public Health Service? One is to prevent people from dying, to prevent people from getting hospitalized, to prevent people from getting sick and suffering the symptoms of illness, preventing people who do get sick from having long-lasting symptoms or long COVID, to maintain hospital capacity so that we can treat people with COVID, but we can also treat people who don't have COVID and need hospital services. So that's the collective goal that we have. It's Easter, and it's an important time for families to get together. Those people who recognize it as a religious holiday, it's a time to reflect. I would say that we've been asked this. People should enjoy Easter, enjoy all their holidays. It's an important thing. When one makes a decision about what activities to participate in a long weekend or in a holiday period, I think it's reasonable to consider the risk to the individual and then the risk to the community, or stated another way, how do you minimize the chance of getting sick personally, and how do you minimize the chances of giving COVID to somebody else? So given that, there are following things that I would suggest, and the Public Health Service would suggest, that is, get vaccinated. If you're vaccinated, you're much less likely to be hospitalized from COVID and much less likely to die from COVID. Perhaps half of the people in the district at the current time are up to date on their vaccines or have had 3 doses, if that's considered an index or a measure of being up to date on vaccines. So we have opportunities to improve vaccination rates, especially for people who don't have any vaccine or people who've only had 2 injections up to this point. Secondly, limit gatherings, limit the size of the gatherings. The larger the gathering, the more likely you are to get infected and transmit it to someone else. It doesn't mean you can't go to a gathering, but just contemplate that. Thirdly, if you are going to have a gathering, it'd be better to have a gathering among vaccinated people versus people that are unvaccinated. That's both for the benefit of the vaccinated individuals as well as the unvaccinated individuals. Wearing a mask indoors. I think that we should all wear masks indoors when we can't stay 2 meters away from somebody else. I think that's a good recommendation. And I think that as we move through the pandemic, that we should contemplate how we renormalize the burden of disease. I believe at this point in the pandemic, given the burden of disease, given the fact that we've had week upon week increases, I think that the province should reinstitute masking direction. We've said this previously. I think it has to be a province-wide direction, and I think it should be time limited. Wearing a mask indoors is one of a suite of measures that are likely to attenuate the increasing burden of disease. I think my colleagues in Windsor, in Niagara, and in Peterborough have also articulated a similar position. I think that where we are in the pandemic right now is that we need to take additional measures to help diminish the burden of disease. That includes reducing people that get sick and also minimizing transmission of COVID from one person to another. So thank you for allowing me to share those remarks. And if I've missed anything, I think that Nicole and Ramsey will supplement my comments. And if not, we're happy to take questions.
Thank you very much. We'll move into our round of media questions. We will start with questions from CBC.
Yes, hello again. I wanted to talk a little bit about schools. I know we touched on this a few weeks ago, but we're hearing locally that schools are very short-staffed. Many students are absent. How is WeChew supporting what's happening in schools right now?
Well, there is dialogue between the school district, the school boards, and and the Public Health Service. We give guidance and share our perspective with school board officials. I think that it's entirely appropriate for schools to use their policy levers to require masking when children attend school, and that would be our recommendation to the school districts. We are concerned about absenteeism in schools. We're also concerned about absenteeism among hospital staff as well. And so that's another, and I appreciate you highlighting that fact, that's an additional burden to public institutions, including schools and hospitals.
If I could just add, as it relates to schools, I think you asked how else we are supporting them. And as Dr. Nasathuri said, we do regularly and often connect with our school board colleagues, but as well, we do have school nurses and also our public health inspectors support schools. We do monitor absenteeism, support principals and administration and, infection prevention and control advice and guidance. And so that is, that is just one other way that we are supporting our schools.
Thank you. So just to be clear, has the health unit directly given that advice to schools that they should reinstitute masking? We're kind of seeing that in other boards across the province. So is that the advice that's been given to the boards right now?
Well, that's my advice today. I think I've shared advice of that nature in the past. I think where we are in the pandemic today, school boards should institute a masking policy. It is one measure, it is one component of trying to attenuate the increasing burden of disease, and that should be reevaluated on a regular and periodic basis. I think it'd be helpful if the province were actually to give direction in this regard, because I think uniformity across the province would be helpful. I think the burden of disease right now can be reasonably characterized as more province-wide challenge than a local health district by health district challenge.
Thank you.
Any questions from CTV?
Yes, good morning. Sorry, I was having technical difficulties earlier. Did the health unit put in a 3-shot vaccine policy for staff, and if so, why?
Maybe Nicole can answer that question about the operational aspects.
Sorry, could you, I didn't hear the question.
Sure. It was just if the health unit put in a 3-shot vaccine policy, as in 2 shots and a booster for staff, making it mandatory.
So we do have a immunization policy that was implemented last summer, and we are in the process of updating that immunization policy as it relates to current recommendations.
And
yeah, if I could supplement that.
Sorry.
Yeah, sorry for speaking over you. Go ahead. I'm sorry.
No, go ahead. Go ahead.
The Public Health Service recommends that people be up to date on their vaccine. And at the current time, that is 3 injections for many people. Some people it might be more. And so we would recommend that people be, as a general construct, up to date. The health district, and Nicole, who manages the health district, will promulgate policies. But the most important characterization is that people should be up to date. Moving forward, it's likely that we will need an annual or semi-annual booster injection to maintain immunity.
Okay. And if they don't get that 3rd shot, could they face termination?
Are you for our individual workplace policy?
Yes.
It is. Yeah. So we've had our vaccination policy has been in place, like I said, since the summer. And there are a number of elements, including there are reasonable accommodations within the policy, and we'd work with individuals through that if accommodation were required. All of our staff are vaccinated as part of our policy that was implemented last summer.
Okay, thank you. And just more on Easter, you talked about some guidelines. Are you particularly concerned due to the increase in the burden of disease in the community with the Easter gatherings that people might be considering?
Yes, I think that when we look at the history of the pandemic, a couple of things. One is that pandemic is unpredictable. And secondly, we know that when there are larger groups of people gathering, there's more likely to be disease transmission. We know that dining events are particularly risky events for disease transmission, because people aren't wearing a mask and it's harder to maintain social or physical distancing during those activities. So the holiday period, be that Easter or other holiday periods, are potentially times of increased disease transmission. That being said, I think that one can make reasonable risk-benefit decisions for themselves and for their families to minimize their chance of getting sick, as well as minimize chances of disease transmission. meaning that if you get infected, how one can preventing other people from getting infected from you.
Thank you.
Any questions from the Windsor Star?
Yes, thank you. This might be a question more for Ramsey. If I'm reading the epidemiological summary correctly, the signal intensity for the presence of COVID in wastewater is at one of its highest points since monitoring began. Can you confirm that it is the highest? And what is this attributable to?
So it's you're almost correct. So it's not the highest. However, it's on track to potentially be at the highest, which we saw during the Omicron wave, or potentially even surpass that as the weeks and days continue ahead. Yeah, with the lack of testing across our population. This is one indicator that gives us some insights in terms of what we might be seeing across our community.
So what can the public draw from that? How is the public to respond to that kind of peak in the data?
I can begin and pass it back to Dr. Nestori. I think what it translates to is that we are seeing community transmission in our region, and in terms of where we were this time during the Omicron wave, we were able to understand that people are getting sick. We are seeing sick people also end up in the hospital when it comes to admissions as well. So in terms of what that translates is that COVID is in the community, it is circulating, in terms of being maintaining a risk, I think that's something that Dr. Nestori spoke to, and I'll let him comment on that a bit more.
So the first thing I would share is that no one data element can be considered in isolation. Wastewater data is a new metric or newer metric of burden of disease, and what its relationship to the overall assessment of risk. I think we are still exploring and working through. It's clearly one metric, though, that we can use. When we look at the wastewater data with other metrics and other metrics that on the face of it have some level of validity, the number of people who are sick, the number of people that test positive, the number of people currently in hospital, the number of people who died, they all seem to be going in a direction consistent with increasing disease burden. And this has been going on for a number of weeks. So pulling it all together, I think that we can reasonably infer that we're having an increased level of disease activity in the community. I would be way more on hospitalizations, ICU admissions, death, than wastewater data alone. So when we think of all the data elements that we have, it's important to consider wastewater data, but it's definitely not the most important factor.
Okay, thank you.
Any questions from AM 800?
Good morning, Doctor. Just going back to masking. Last week, you talked about how you were concerned and called on the province. And then this past Monday, the province held their news conference. The Minister of Health and the Medical Officer of Health for the province, and at that time said they're not putting masks in place. If you're that concerned and if you think it would make a difference for Windsor-Essex, why won't you implement a policy here for Windsor-Essex on your own without waiting for the province?
Well, I think the first comment I'd share is that my colleagues in Niagara and in Peterborough have also asked for masking mandates. I think that for for that to be successful, it really has to be more of a province or regional-wide strategy. Secondly, masking is just one part of the component of suite of public health measures that will have an impact. I think requiring people to be wearing a mask indoors is likely to attenuate the increase in cases, but it's only one component. Other things that are important are physical distancing, minimizing the gatherings of individuals, staying home when you're sick. Every option remains open to the health district, and it's at the current time, the health districts will continue to make this very strong recommendation to members of the community. If there's one thing about the pandemic, it's unpredictable, and there may be a time when the health district has to act at a local level, but my preference would be to see province-wide a province-wide approach to requiring people to wear a face mask indoors for a time-limited period of time.
And then go back to the question my colleague from CBC asked in regards to school boards. So do trustees, and I'm not sure if you have this answer, but do trustees have the power to implement a mandate like that?
Yeah. I'm not an expert on I'm not a lawyer, and I'm not an expert on the governance of the schools. But as a layperson, I think that school boards have broad discretion in managing the school district, and I do think it's within their discretion to implement policies of this nature. I think it is the right policy at this point in the pandemic. Again, it's important to put that requirement in context. Requiring young people to wear masks in school will reduce transmission in school, and that's worthwhile. But really, young people, when we reduce transmission in school, they're breaking the chain of transmission. And the ultimate beneficiaries of breaking the chain of transmission include people that are currently unvaccinated. So I think that as we move forward with that as a public policy imperative or a public policy decision, then we also have to think of other things that we do as a suite of measures to try to continue to bring the burden of disease down.
Thank you. I think this last one's for Ramsey. Ramsey, keeping with the school-age children, the high-risk cases that we're seeing here locally, I believe yesterday it was 131. It's been over 100 for the past few days now. I'm not sure if you have this information in front of you, but those high-risk cases, are a lot of them within the school-age children?
So it would include children based on the testing eligibility. However, it can include children if they're household contacts of those individuals that are part of high-risk settings, such as healthcare workers. But there would be more sporadic in nature in terms of them being tested compared to a systematic approach to testing school-age children.
Okay, thank you.
We'll move into our follow-up round of questions with one question per media outlet. We will start with CBC.
I think I'm good. Thank you.
Great, thank you. CTV.
No, thank you.
Windsor Star.
Nothing further, thank you.
And back to AM 800.
No, thank you. Have a great weekend, everyone.
All right, thank you all very much for joining us. Our next media briefing is scheduled for Thursday, April the 21st. Have a wonderful Easter weekend.
Thank you. You as well.
All the best.
Thank you.